There we go. All right, Katherine Albrecht here, broadcasting on YouTube. If you go to the Katherine Albrecht radio show, I think it's Dr. Katherine Albrecht Show, you can find me there without any announcements really at all other than on this radio program. And not really official. I haven't officially said it's time to find me on YouTube, but we are already up to nearly 100 subscribers. I am not quite ready for prime time in terms of letting the 9,500 people on YouTube know that I am back and live and broadcasting, but I think I'm almost there. There have been a couple of hiccups this week as we have a multi-purpose, multi-use studio here. This weekend, we will be releasing the interview that Pastor Anthony Farrell did in this very studio. You will recognize the background, and I'll give you the link. The interview that he did with Ed Schutte from Before It Begins, dealing with pornography, addiction, dealing with sexuality, and dealing with the church. And he was here last Saturday for a day-long conference that was absolutely great. It was really good. It was the opposite of what many people have come to expect from Christian sexuality education. It was not about shame. It was about the opposite. It was about the wonderful gift that God has given us through sexuality. And that was created by him. That was not an invention of the enemy by any stretch. In fact, it's the enemy who twists it and has turned it into something dirty, polluting, and destructive of human life. Anyway, it's going to be a 4-part series. They did 4 20-minute interviews. I was the person with my headphones on back in the background, making it all come together and work. And I think we did a pretty decent job. So I'm excited. That'll be launching on Sunday. And if you are, I know that many of my listeners regularly tune into the Crossroads Community Church, crossroadscco.com broadcast to catch the sermon every Sunday. Pastor Anthony does a great job, and it is streamed on there. I believe the first episodes of his interview podcast will be on the Crossroads CCO YouTube channel. There we go. And he may be creating another one. He has a podcast that he does. He's been doing for a couple of months with Blue Water Healthy Living, which is a studio up in Port Huron called The Table. And he has interviewed a lot of local lawmakers and officials and people in town on that. So he may be launching that as well. The other thing that's going to be coming up is he and I are planning out a series of what should be kind of interesting conversations regarding technology. We were going to record those yesterday, but I wound up having a CMH board training, so I wasn't able to do it. Not that is of any interest to you guys, but we will be, I think we're going to reschedule that to next week. And the plan is we're going to do, I believe, 4 interviews also in one shot. They're going to deal with cell phones, the way that conversation is going to go is I'm going to do my usual Katherine thing of here's the statistics, here's the problems they've caused, here are the issues that we're facing because of this technology. And he is going to interview me and ask some questions about just the facts. And then we're going to talk about the theological and spiritual implications of that for the church, for the body of Christ. What does that mean for us? So we're going to do that with, I believe, cell phones. We're also going to do that with video games, social media, and, of course, my favorite topic to hate, artificial intelligence. So stay tuned for those. They're going to be launching. In the meantime, I have been behind the scenes making advertisements, my little, I know you're like ads, schmads, but this is my, if you listen to my show back in the past, you know that I used to run an ad that would encourage people to read the book of Matthew and talk about the good and wonderful things that God has done in my life. And so when I say ads, quote unquote, what I'm talking about is content that will run in the advertising spaces on KHNC for the YouTube broadcast. So they will be videos similar to what I've been putting up there. I guess I've just been putting up Project of Love videos, so they won't quite be like that. But anyway, stay tuned. I've got some cool content coming up. Today, what I want to talk about is cancer. And I know you're rolling your eyes if you don't have if you have had cancer in your past or have it currently in your life now, or if you love someone who's had cancer in their life or does now, you know it's a very heavy and serious topic. New listeners may not be aware that I have stage 4 breast cancer. Stage 4 cancer means cancer that has begun in the place that it got started, wherever that might be. It might be lung cancer, skin cancer, breast cancer, prostate cancer. There's any of a number of places in the body where cancer cells can originate and go awry, lead to a tumor. And if that tumor is not caught in time, and if it is not stopped in its tracks, its next step for the tumor is it wants to hop into a person's lymphatic system. That's your second circulatory system. We all know about the blood circulatory system, the veins and the arteries that the heart pumps, but you also have a lymphatic system, which is that clear pus, that clear white blood cell, the white serum fluid, and it pumps through your body. And you may be aware of your lymphatic system because if you get a bad cold or if you have an infection, your lymph nodes, typically in your neck or in your groin, kind of where your legs begin, you might feel some bumps there, and that's when your lymphatic system becomes, it's filtering out the toxins and it's doing things to keep you, to help fight the infection. That lymphatic system runs throughout your whole body. We rarely talk about it. They don't talk about it in school. I don't remember ever being taught about the lymphatic system when I learned that, the digestive system and the circulatory system and the nervous system. There's also a lymphatic system. So the talking about stage 4 breast cancer, it's when a tumor in its original site, wherever it might have begun, it wants to send out sort of tentacles, kind of like an amoeba, it sort of stretches out in different directions, and it tries to reach the lymphatic system so that it can send cancerous cells into the lymphatic system that will then travel around the lymph system. And once they have managed to destroy the lymph nodes that are designed to stop them, then at that point they will seek out a distant location in the body to start a new colony. And that is typically how cancer, that's pretty much how cancer does you in. I'm sure it's happened in the past, but typically people do not die. Women don't die because their breast gets infected and gets cancer. The cancer is a starting place in the breast, and then it spreads, and it wants to spread, in the case of breast cancer, to the lungs, to the liver, to the brain, or to the bones. That's why oftentimes for advanced cases of breast cancer, you'll see people with broken bones, maybe in a wheelchair, walking with crutches or with a walker, and having bone problems. In my case, the cancer that had originated in my breast took out 12 out of 24 of my lymph nodes under my left arm. I had surgery and they were able to stop it at that point. So I had a mastectomy. I had chemotherapy. I had radiation. The purpose of the chemotherapy is to stop any rapidly dividing cells from continuing to rapidly divide. That's why you lose your hair, because your hair is the cells in your hair. The reason it grows so fast is because those hair follicles are producing cells at a very rapid pace. And during the time that you're receiving chemotherapy and, for a couple hours afterwards, it destroys basically any cell that is in the process of replicating, splitting in half. That's how chemotherapy works. So the cancer cells, they are pretty much by definition cells that replicate out of control. They're growing very fast. That's why they turn into tumors, like your normal skin or a normal cell just kind of normally makes new cells, sloughs off old ones. But in the case of cancer cells, they're growing really fast and they don't ever die. That's why you get these big lumps and tumors. All right, when we come back, I'm going to talk about what I did regarding that. And this is in response to an email from Camille. So Camille, if you're listening, this is for you. All right, stay tuned. think that didn't work. All right. I think I just messed that up. Hang on. I am trying, for those of you watching on YouTube, I hope I didn't just, hang on, there we go. Okay. I was trying to do something on the fly that probably wasn't a good idea to do on the fly. I was trying to bring up my browser window so that if you're on YouTube, you can actually see the window that I'm looking at. I'm going to figure out how to do it. I've been able to do it offline. I just couldn't do it live. So I think I had to add a, let's see. I think I had to add a new, anyway, it's technical. So, but what I have in front of me, I'm gonna be sharing with you in just a sec. Let me just bring you up to speed with the discussion about cancer. So you do the chemotherapy to stop any fast replicating cells. There's a purpose for that. It does kill any cells that are replicating. So any cell in your body that's in the process of splitting. The way chemotherapy works, or at least the chemotherapy I received, is you got a cell, right? And you've seen this from like ninth grade biology. The cell is here, and then it kind of squishes down in the middle and kind of turns into two different cells, and then they come apart. Well, in that coming apart process, the chemotherapy makes it so that the coming apart, they just kind of both open up and go bleh and die. That kills cancer cells, which is a really good thing. It also kills the cells in your hair follicles that are replicating, so you will lose your hair. In my case, I did something called cold caps. So they are dry ice caps. I'm sure they've come a long way since I did this back in 2011, but the cold caps are a horrible, horrible freezing cold cap you put on your head, and it stops the cells from replicating because of the cold, and so they don't die when you do chemotherapy. And a lot of women have managed to keep their hair. I kept a lot of my hair. I lost a lot of my hair. So I would say it was expensive and probably worth it. I never saw like bald scalp or anything, but you lose your hair. The other cells that are replicating rapidly are the cells in your digestive tract, because clearly you need to constantly be replacing the lining of your stomach, because the lining of your stomach, your stomach's filled with hydrochloric acid that eats up flesh. So you need to replace those on a pretty regular basis. That's the reason why chemotherapy in the 1970s was associated with a whole lot of vomiting and sickness. Nowadays, they give you they have really good drugs for the nausea, so I did not experience that. And the other ones are the cells in your mouth, because as you eat hot food, if you've ever burned your tongue, it repairs pretty quickly, because those cells also are replicating quickly, and you can get sores in your mouth from chemotherapy. So anyway, that's the background on chemo. The radiation is there. They will irradiate the site where the cancer began. So in my case, I received radiation right over my heart because it was my left breast that had the cancer. So you go in, they irradiate you. They basically shoot radiation at at the site of the cancer. It causes the skin to kind of wrinkle up and get kind of leathery, like it's no longer stretchy. It's quite a process. I have many things to say about all of this, and I did natural supplements throughout that caused a lot of the side effects to not affect me. So it was brutal going through all of that, but it wasn't as brutal as it could have been. I didn't have open blisters or anything like that because I took resveratrol. So look it up. Resveratrol will get you through radiation without a lot of blistering and pain and redness and things. So anyway, so I did the mastectomy, I did the radiation, I did the chemotherapy, and afterwards I was cancer-free. Okay, that's how it works. They take out the original cancer, they do those things, and then you cross your fingers. Well, what typically, if you receive cancer treatment, what happens is the cancer, at some point, you hope it never comes back, but at some point it may come back. And the best way to think about this is that cancer, that original tumor, is sending out its little tentacles. It wants to get onto the lymphatic system. It wants to get into there and send out kind of like little rafts to make new colonies elsewhere. So it'll send little boats out to colonize the rest of the body. They will travel through the lymphatic system, and when they reach their target organs, in the case of breast cancer, the lungs, the brain, the liver, and the bones. In the cases of other cancers, it can be other locations, but each particular cancer has a distant location it wants to reach. And when it gets there, it will either start a colony right away, in which case you have stage 4 cancer, or it might get there, then you go through all the treatment, and it just kind of goes dormant. And the way to think of that, the way I think of it, is in my case, the original tumor that I had done that, and it had put those little colonizers into my brain. But all of the treatment that I received kind of held them at bay, sort of stopped them. There is now. Let me talk about the miraculous cancer treatment that saved my life. I was on a clinical trial through Cornell Breast Center. So this is all allopathic medicine approved by the FDA. This is nothing woo-woo about this, but it was experimental. I got on a trial for something called tetrathiomolybdate. I have, if I could have brought the window up, I would have shown you this, known as TM for short, tetrathiomolybdate. And what tetrathiomolybdate is it is a copper chelator. And what it does is it simply removes the copper from your body. So some things are iron chelators, some things are, chelate calcium and chelate other things. I don't know about calcium, but tetrathiomolybdate chelates calcium. Chelation means removal of a mineral, typically a metal, from your body. And it saved my life. It saved the life of every other woman who was in my trial, pretty much. We had pretty advanced cases of breast cancer. And I think out of 100 women on my trial, I think like 97 of us were still alive years and years later, whereas it should have been the other way around. Not should have been, but left to its own devices, the cancer would have done that. Now, here's how it happens. So let me see if I can, in a nutshell, explain this quickly. When someone gets a cancer, wherever it originates, right? It could be skin cancer, breast cancer, lung cancer, prostate cancer, it doesn't matter. Wherever the cancer originates, what they call cut, burn, poison, the allopathic approach, which is to remove it through surgery, to poison it, quote unquote, through chemotherapy, and to burn it with radiation. Those are good things. You want to cut, burn, and poison your enemy. That's a good thing. So cut, burn, poison, I'm all for it. Absolutely wonderful thing that I was able to, that the doctors were able to take this aggressive enemy that wanted to take my life and burn it up, poison it, cut it out of me, and get rid of it. After that process happens, the cancer cells that have gone to the distant locations are kind of like weed seeds in the desert. If you are out in the Mojave Desert and someone has sprinkled a whole bunch of weed seeds on the, on the ground, those weed seeds are never going to grow unless there is water hitting them. Right? So what they discovered, what the researchers who developed tetrathiomolybdate as a therapy, what they discovered is that those weed seeds will never grow unless they are exposed to something called EPC, which I thought was an irony because that's also the electronic product code that I was fighting with RFID. So I was fighting EPC on two fronts. EPC is a natural chemical that your body produces. And what they found, they were trying, so for years and years, they've been trying to figure out why is it that cancer can be treated and then it stays away for, 6 months, a year, 5 years, 20 years. Some people have this, their cancer return 20 years after a successful treatment. And they wanted to understand, why does this happen? So they did blood tests on people with cancer. And what they discovered is that for people who had treated cancer, is right before the cancer recurs and spreads to a distant organ, there's a flood in the body of this EPC. So then they had to figure out, it was actually measurable in the bloodstream, a huge surge of EPC. And after the surge of EPC, in virtually every case, the cancer came back. So now the question was, okay, well, what is this EPC? Well, it is a kind of a growth hormone that your heart uses. It's perfectly healthy. There's nothing wrong with it. But in the case of people with cancer that is in remission, it comes out in large quantities, and those large quantities act like the rain in the desert, on the Mojave Desert. Not only rain, but rain with miracle grow in it. So all of a sudden, you've got all of these kind of dormant cells that have managed to get to these distant locations and aren't really doing anything. Once the EPC comes out, it just springs them to life. So their next question was, well, what is this EPC and how can we stop it? And what they discovered is that in order for the body to produce this EPC hormone, it has to have copper. Copper is one of the ingredients. Like if you want to bake a loaf of bread, you need flour. Okay, so without copper, the body literally just can't produce the EPC, can't make it at all, because it's one of the things the body requires to do it. So then the next question, or the next strategy, was how then do we make sure that people who have had cancer before can have no copper in their body so that the EPC cannot be released. And I was on a clinical trial of this copper chelating medication called tetrathiomolybdate. I will break that down. Tetra, I think, means 3. Thio, I don't know what that means. Molybdate comes from the word molybdenum, or the on the periodic table, if you remember your high school chemistry. Molybdenum, molybdenum. There we go. Molybdenum is one of the elements on the periodic table. The tetrathiomolybdate is an ammonium salt of molybdenum. So they take the chemical molybdenum, the element, and they create a salt by mixing it with ammonia. They get a salt out of it. And when a human being consumes that salt, the copper comes out of their body. It basically chelates. It binds with the copper and it just excretes it out of the body. And you wind up slightly copper anemic. And surprise, surprise, when you are copper anemic, the cancer cannot come back. Yeah, and that's what happened to all of us on the trial. Absolutely amazing. I wouldn't be here otherwise. All right, stay tuned.
Look at the birds. Look at the birds. I tell you not to worry about everyday life. I tell you not to worry about everyday life. Can all your worries add a single moment to your life? Look at the birds. Look at the birds. Look at the birds. Look at the birds. And if God cares so wonderfully for wildflowers, He will certainly care for you. And if God cares
Hey, I'm back. All right, I think apologies to YouTube viewers. That was a mess of a break there. I'm doing my best. I'm really trying hard to figure out how to get this web window up. Hopefully by Monday, I'll have figured it out, and you'll be able to see those. See it in real time as I'm seeing it, because that will be super cool if I can actually stream right through YouTube the window that I'm looking at. But for now, you're just going to have to take it on faith, and I'm just gonna read it to you. All right. So I am on the National Institutes of Health website. This is the place where you want to go to get medical research, like real research, not just a Google search on whoever says whatever about, health things, because you can't trust that. But the National Institutes of Health, pubmed.gov, is the website where you can read the official real medical journal articles that are peer-reviewed and show all of their methodology and have the background and the science and everything in them. And this is research that, to the extent you can trust research, this is research that you can trust. So you want to go here. If somebody says, lemon juice, baking soda, that's what you need to cure your cancer, or, try this oxygenated water or whatever it might be, go on pubmed.gov and look it up and see if it's true. I went on PubMed and found, in fact, I'm going to give you two websites. PubMed.gov has information on a whole lot of things that people recommended for cancer that turn out to be really bad for cancer. I can go on there and I can look up certain supplements. You just type it right into the search engine. You can type breast cancer and clover extract, and you can see if anyone's done research on that or reviewed it. The other website that I highly recommend, and this is from a woman at UCLA, and I need to reach out to her. I've been appreciating her work for over a decade now. It's called Food for Breast Cancer. Let me make sure it's still there. Food for Breast Cancer, breastcancer.org. Oh no, having trouble finding this website. Please tell me it's not gone. If it is gone, by the way, do you guys know about archive.org? Yeah, that's where you can find food for breast cancer. It's not there. Oh, no. All right, it was there the last time I checked, within the last year. If you can find it, foodforbreastcancer.org. She has done yeoman's work in going through all of the research on pubmed.gov and compiling information about what food is and isn't good for cancer. I think Anyway, there are other websites I can give you. But for right now, let's just focus on pubmed.gov, which is all of the journal article. Now, I typed in tetrathiomolybdate, if you can spell that, tetra, T-E-T-R-A, thio, T-H-I-O, molyb, M-O-L-Y-B, like molybdenum, and then date, tetrathiomolybdate, cancer. And I put in the word Cornell, too, because it was Dr. Linda Vidot at Cornell Breast Center who was running the trial that I was involved in. There are a ton of articles on this, and what I discovered is that tetrathiomolybdate, the chelation of copper, prevents this EPC surge not only in the case of breast cancer, but in the case of other cancers as well. It is an incredibly promising route to literally prevent cancer from killing people, preventing it from coming back. It only works if you're able to get rid of the initial site of the cancer. So you have to do the cut, burn, poison first. You have to get it out of there. Make sure that there are no active tumors anywhere in the body. And then what the tetrathiomolybdate, the TM, the copper chelation does, is it prevents the EPC surge that acts like the rain and the Miracle-Gro to make any of those little latent in remission cells to keep them from bursting into, I don't know, what you get in California, like in the springtime, hillsides are all dry, and then all of a sudden they're covered with plants and weeds and wildflowers and things. That's what you don't want in the case of cancer. Here's the problem. So yeah, there had to be a catch, right? I was on this medication for a number of years, actually. Let me go back to my own story. So in 2011, I went through cancer treatment, and very aggressive cancer treatment with 3 different types of chemotherapy. I was on another experimental drug that's now called Kadcyla. At the time, it was called TDM1, having nothing to do with TM. I had the radiation. I did the whole 9 yards. And that was at the the Dana-Farber Cancer Center in Boston associated with Harvard. So I had access to all the clinical trials and all the absolute best treatment. In 2011, I did that and I was fine. And my cancer was not stage 4, it was stage 3C. So the way they stage these cancers, there's like stage 0, stage 1, and it has to do with the size of the tumor and how much it is spread. So in the case of stage 3C, the tumor that I had was literally 5 centimeters, like huge. It was really big. And it had spread into my lymph nodes, but it had not gone beyond them. It had not reached any distant sites. And so I was very fortunate that my cancer had not hit stage 4. Stage 4 is when it's gone to a distant site, and it's then considered to be incurable. That may be changing now, by the way, but that's always been the case. Stage 4 is considered the one that is incurable and the one that will likely result in your demise. So I was stage 3C, which is right on the cusp. It goes A, B, C, and then you go stage 4. So I was right on the cusp of being stage 4. So I went on this trial and I took this tetrathiomolybdate. I drove to New York City. I drove from New Hampshire to Manhattan, my 4-hour drive down there, which I did once a month. I picked up a little container of my tetrathiomolybdate pills that were given to me. They had hardly any side effects at all. They were extremely inexpensive. Molybdenum is not an expensive chemical at all. So I didn't have to pay for them because it was on a trial. But I would drive down there. They would draw my blood. They would test for this EPC. Unbeknownst to me, I really didn't know all the details until later. They gave me this medication. I took it daily, and then I go back the following month and do it again. Okay, well, this went on for a couple of years. And then in 2014, I said to myself, stupidly, I said, why am I on this? This cancer isn't coming back. I'm fine. There are some slight side effects of being copper chelated, especially for women. You know that, women who pay attention to anti-aging supplements will know that there are often copper peptides, right? You'll hear ads for them on here. I do not support copper in any way, shape, or form because it contributes to cancer. So I'm big on avoiding copper. But there are copper peptides in certain anti-wrinkle creams and serums and such. And the reason for that is that copper is involved in the production of collagen that keeps your skin supple and gets rid of wrinkles. And if you are depleted in copper, which you have to be to keep the cancer from coming back, you get fine lines. Now, I was probably getting them anyway because I was getting older, but I remember looking in the mirror and saying, I don't need to be taking this copper depleting thing. So I went off of it. Now, unbeknownst to me, I continued to go down every month. Unbeknownst to me, my EPC level shot through the roof when I went off of the TM. And they didn't tell me that. I didn't know. My doctor, however, made some pretty strong hints that I needed to go back on. So I went back on. But in the meantime, once that EPC surge hits, no amount of preventing additional surges is going to help you because that is the miracle grow in the rain. And so from that point that APC surge hit, a huge tumor, in fact, 2 of them, began growing in my brain. And even though I was only off this medication for maybe 2 or 3 months, the damage had been done. The EPC surge had happened, and those tumors were growing even though I was daily taking tetrathiomolybdate, the TM copper chelation, and I was copper chelated. It still happened anyway. So listeners may remember, if you were listening, in January of 2015, I was actually doing my radio show. I went on a break. I had a 2-hour show then. I would have a 15-minute break in the middle. And on my 15-minute break, I was barfing my guts out. I was lying on the floor of my bathroom yelling, tell the station I can't come back. I was on GCN then. I was like, tell GCN they got to run a rebroadcast. And that was through a whole series of circumstances, we discovered that I had huge tumors in my brain. I then had an emergency craniotomy surgery, brain surgery, 10 hours of brain surgery, had the whole back of my head removed, the whole back of my skull. I have a scar like this long, but it's under my hair. And yeah, so once they removed it, they had to irradiate my brain. I had this huge surgery, went through this whole thing, and you better believe it, went back on TM and stayed on it for the next couple of years until something very bad happened, and that is that the FDA decided to no longer make it available to those of us whose lives were being saved by it. So the FDA, out of the blue, for reasons that I think are still somewhat mysterious, they said that no longer could anyone be given tetrathiomolybdate, TM. This was not because of safety or health. Believe me, it's much safer and healthier than chemotherapy or radiation ever was. For other reasons, which I suspect are financial reasons, they banned it. They said, well, not ban, I don't think banned is the right word, but they prohibited anyone from giving it to anyone ever again. So here I am, and I'll tell you why I'm still here despite that, because I thought that was a death sentence. I thought that was the end. All right, stay tuned. I'll tell you the rest in a moment.
I knew you before I formed you in your mother's womb. I knew you. I knew you before I formed you in your mother's womb. I knew you. Before you were born, I set you apart. Before you were born, I set you apart. I set you apart. Don't be afraid of the people, for I will be with you. Don't be afraid of the people, I will protect you. I have put my words in your mouth. I have put my words in your mouth. Look, what do you see? I see a branch from an almond tree. Good eyes, I'm sticking with you. I'll make every word I give you come true. Today I've made you strong, like a fortified city. Today I've
Goodness and mercy. What beautiful things. Those are the fruits of the Spirit among the many fruits of the Holy Spirit. The fruit of the Spirit is love, joy, peace, gentleness, goodness, faith, meekness, temperance, which is also known as self-control. And against such, there is no law. There are no laws, no matter where you go, against love and goodness, patience, mercy, and kindness. They're good things. And they are the fruit that comes from living a life that is pleasing to God and a life that is focused on the fruit, focused on walking in the path of obedience to goodness, which causes your heart to be a really pleasant place for the Holy Spirit to dwell. And it's a beautiful cycle. And I'm not saying I'm by any means perfect. But what I can say is that I always know when I'm out of line to return to humility and love, and that makes my heart into a place that the Holy Spirit, once again, is comfortable dwelling, so I can get those beautiful fruits. All right. All the days of my life. So at the time that the cancer returned for me, and I had that, it was actually an 11-hour craniotomy, an 11-hour neurosurgery. I did not think that I would be here very long. I actually had goodbye letters to people. I really thought it was the end. That was when I put together the, well, it was actually before that, but the book, the children's book, I Won't Take the Mark, was during that period of time after 2011, when I said, stage 3C breast cancer, that's a pretty serious thing. I better make this, I better get this book out that I was pretty much instructed to do, kind of like right now, the book I'm doing right now. So that's how the children's book came about. And that's why it's printed on such really nice paper and is such an expensive and high quality book, because I just didn't think I would be doing much else with that tithing money after I would no longer be here. So I encourage you, check it out. Go on to Amazon and check out I Won't Take the Mark. It is a beautiful, beautiful book. I can't really take the credit for it, because I really do think that was inspired by God during that period of time. It is a beautiful, October, the end of October now. So it's probably time to start thinking about Christmas presents. And that would be a really, really good Christmas present for the kids in your life. Anyway, to get back to my story. So tetrathiomolybdate, I have an article here influencing, all right, bear with me, it's a long article title on PubMed. I'm going to ask Lori to post this one in the archive description of today's show. Influencing the Tumor Microenvironment, a phase 2 study of copper depletion using tetrathiomolybdate in patients with breast cancer at high risk for recurrence and in preclinical models of lung metastases. Now, I was not involved in the lung metastases, but they have tested this for various different cancers. Purpose: bone marrow-derived progenitor cells, including endothelial progenitor cells, EPCs, and copper-dependent pathways, model the tumor microenvironment. We hypothesized that copper depletion using tetrathiomolybdate would reduce EPCs in high risk in patients at high risk, would reduce EPCs in high risk for patients with breast cancer who have relapsed. That sentence makes no sense. We investigated the effects of tetrathiomolybdate on the tumor microenvironment in preclinical models. All right. Patients with stage 3 triple-negative breast cancer, stage 3 and stage 4 without any evidence of disease. That's NED, no evidence of disease. They call us dancing with NED. I think the common vernacular for that is in remission, but the official medical term is NED, no evidence of disease, received oral tetrathiomolybdate to maintain ceruloplasmin. Now, cerulo, that's copper. Plasmin is the blood level in the plasma. Ceruloplasmin between 8 and 17 milligrams per deciliter, I guess, for 2 years or until relapse. That level, so copper levels can between 8 and 17 is pretty low. I think it's like between 40 and 60 is considered normal. So between 8 and 17 is pretty darn low. Endpoints were effects on EPCs and other biomarkers. So this is why they had me driving down there every month and taking my blood so they could test to see if the EPC was surging out of me, which while I was on the medication, it did not. They looked at event-free overall survival, meaning cancer doesn't come back, for laboratory studies, blah, blah, blah. And then they also did this, poor mice. They took mice and gave them breast cancer. They put the cells in them, but they had not yet turned into tumors. And then they also gave them TM, tetrathiomolybdate, chelated their copper, and found that those cells that they had injected into the mice that didn't have the copper chelation, well, they all got tumors. And the ones who were copper chelated did not develop tumors, even though cancerous cells were injected into them. Results. All right, 75 patients enrolled. I think mine, I think this was the trial I was in, but I think there were more. 51 patients completed 2 years. Most common grade. All right, so the most common toxicity is pretty much non-toxic at all, was neutropenia. Neutropenia is just low white blood cell count, and you can counter that by taking Corylus mushroom. Lower copper levels correlated with reduced EPCs, and they stats on that. 2-year event-free, basically being without cancer recurring for 2 years, was 91%. All right, et cetera, et cetera. So the conclusions. Now, this article is this was published in 2020 regarding research that was done in 2017, and that was right around the time that the FDA withdrew it. So this is kind of the last hurrah on this research. The conclusions: tetrathiomolybdate is safe, well tolerated, and affects copper-dependent components of the tumor microenvironment. Biomarker-driven clinical trials in high risk for patients with recurrent breast cancer are warranted. All right, well, this was very promising, and I truly believe that copper chelation just cures cancer. It doesn't, I mean, if you want to call it cures cancer, it keeps people from dying of cancer. It doesn't eliminate the cancer cells that are the weed seeds out in the desert, but it prevents it from ever raining on them and prevents it from coming back in most cases, unless you go off of it stupidly. So in my case now, why am I still here if the FDA banned it? Well, in 2018, I heard from the compounding pharmacy, which had been providing this. So basically, you're going to get your pharmaceutical drugs either from a big pharmaceutical company at the pharmacy. You just drive through your CVS and get them there, or if it's something like this where a big pharmaceutical company is not producing it, then you can get it from a compounding pharmacy. Those are pharmacies that take the raw ingredients, put them together, put them in the capsules, and make them available to people. So I was getting this through a compounding pharmacy. After my cancer returned and I had my brain surgery, they did not let me back on the trial because I no longer qualified, but I was able to continue getting it from the compounding pharmacy that had made it available in the first place. When the FDA said no more, people can't have this anymore, I reached out to the woman at the compounding pharmacy I'd been working with, and she and I together contacted the hundreds of patients who were on this and let them know that they better stock up because it was not going to be available any longer. And so she spent, days, day and night on the phone, sending emails and sending out batches of TM. And then the boom came down and they could no longer do it. I'm running out of time, but this story would make a really good movie. In 2020, so I went off of it. I'm not going to be able to tell this whole story. I'm going to run out of time. But when it was taken from me, I felt as though the FDA had just walked into a waiting room full of people with cancer with an Uzi and just shot us all, just absolutely murdered every single person there, because I thought, wow, I'm toast if I don't have copper chelation. So there is a drug, there's a medication for excess copper disease called Wilson's disease, which has nothing to do with cancer. But for some people, there is this thing called Wilson's disease, and there is a medication that you can take for that. It is a pain, and why they don't just use TM, I don't understand. That medication is $3,500 a month, and you have to keep it refrigerated, and you have to, it has to stay in the freezer, and you have to take it, something like you can't take it 3 hours. You can't eat 3 hours before or 3 hours after you take it. So you have to have these doses so careful. It was a nightmare. And it didn't even chelate my copper. So I'm Wow, this is like a Batman episode where Batman is on the table and the saw is rotating and it says to be continued, and it leaves you in suspense until the next day, because I'm not going to get to the rest of my story. But I will get to it on Monday. I'll let you know why I'm still alive. And it's, like I said, it's a Hollywood movie. It involves like secret midnight clandestine meetings and all kinds of cool stuff. So I will, I'll leave you hanging over the weekend. I'll tell you about it on Monday. All right. Meanwhile, thank you so much for listening. Look up, go to PubMed.gov, look up tetrathiomolybdate and cancer, and learn more about copper chelation, or even just copper and cancer. And in the meantime, if you're worried about cancer, stay away from anything with copper. That's mushrooms, which I love. Basically look at the copper containing foods, don't eat them, and don't put it on your body. All right. See you Monday.